Hi, everybody. I'm Brent Stafford, and welcome to our special coverage of the Taxpayers Protection Alliance's Good Cop 2.0, the tobacco harm reduction counter-conference to the World Health Organization's COP11. Joining us live from Geneva for Day 2 at TPA's Good Cop 2.0 are David Williams, President at TPA, and Martin Cullip, TPA International Fellow. Gentlemen, how did the first day of Good Cop 2.0 go?
Boy, day two, excited for another day of good cop. Not so excited for another day of bad cop because every day at bad cop is a bad day for taxpayers, a bad day for consumers. But excited to be with you, Brent, of course.
Well, tell us a little bit about what happened at Good Cop yesterday for day one.
Well, it was a bit nerve-wracking because the day one of any conference, you want to make sure everything is working properly, and it was, and the panels were amazing. I mean, we heard from some incredible speakers, Dr. Tiki Pang, who gave a really interesting perspective on the World Health Organization, just what it was, what it's become. And this is someone that I've heard a lot about. I've never met personally, and thanks to Martin, we were able to get him to this conference, and he kicked off the conference, I think, in a really solid way, talking about the challenges with the World Health Organization. And really throughout the day, we heard folks talking about what's happening in Mexico, how the cartels have taken over illicit vape markets, and really what's happening in that country. And I think that is one of the most underreported things right now in the world that's happening. We hear about Australia, we hear about the fire bombings of tobacconists, right? But we don't hear about what's happening in Mexico and the cartels being involved in this. And really, that's what happens. When you make these products illegal, you have organized crime jump right in because they fill that vacuum, they fill that void, and it's having devastating effects. And I think someone yesterday was talking about heads in buckets, right, Martin? I mean, it's graphic, but it's really what's happening in Mexico. The European model, what's happening in Europe, France versus Sweden versus other countries, really a lot of different things happening in the EU. And I think it's very illustrative of some of these countries and how they want to have autonomy and they want to move forward with what they want to do. Obviously, we don't agree with France and banning pouches, but if you look at Sweden and just the model they have been over the last number of years and decades to really reduce harm from smoking with pouches, with snus. And again, we know that Sweden is part of their culture, and it's been a part of their culture for decades and probably over, I think, 200 years now with, starting with snus.
Yeah, absolutely. It was fascinating to talk to Carissa yesterday. She's so young and has such a bead on the whole issue.
Yeah, and when I see people like Carissa, it really makes me excited because this has to be generational. Is that you look at myself and Martin, we're old guys, right? And we're going to continue to do this, but we need the 20-year-olds, the 30-year-olds to take this up and to make sure that, when we're gone, that they're doing this and that they have the same energy and the same resources to do this. And so whenever we come to a conference like this and I see the younger folks, 20 and 30 years old, I get really excited because they are the future.
Martin, let's dive into the first day of the WHO's FCTC COP11, or the bad cop, as you guys like to say. So what happened, and were there any surprises?
Well, no, but I mean, one thing for certain, any thoughts we had that they may have lowered their tone a little bit have gone out the window. I mean, they went full on attack yesterday. I mean, most of it was really the ceremonial stuff. It's the statements and it's the plenary, the speeches. But some of the comments being made were quite incredible, to be honest. I mean, it's no other way to say it. Just for example, the bulletin came out today, and the GATC bulletin, and it's given Mexico the Orchid Award. I mean, we've just been talking about how they've completely lost control of their tobacco market. The cartels are taken over, like heads in buckets, as was mentioned yesterday, and yet they've got an award from the WHO. But the statement in the statements, the strongest statement for harm reduction was New Zealand, and of course they got the Dirty Ashtray Award. Simply for and the reasoning for this for the GACC is quite astonishing. I'll read it to you. They say they've given New Zealand Dirty Ashtray Award for trying to portray their current tobacco control policy as a success, because apparently halving your smoking rate in about 4 or 5 years is not a success according to the WHO FCTC.
That's amazing.
it's delusional beyond belief. It really is.
And it's alternate universe, right? The WHO is living in an alternate universe, as you know, get Mexico getting the Orchid Award and New Zealand getting the Dirty Ashtray Award. And it shows you just how crazy and upside down things are about a mile away from our conference.
Just to put a bit more detail on that, the reason they said because they've abandoned tobacco control policies, and they have this global tobacco industry interference index, and they've said that New Zealand have plummeted from number 2 down to number 53, and they say that's the reason. So it doesn't matter that they've massively reduced smoking rates. According to WHO, the only thing that matters is how harshly they're treating the tobacco industry. And now to give that a bit more context, Sweden, who is now almost smoke-free, and in fact they have a smoke-free generation in the younger generation, as Carissa said yesterday, they have a 2.3% smoking rate at the ages 16 to 29. They're at number 68 of this tobacco interference index. So it doesn't, that interference index doesn't seem to matter a jot as far as I can see, because the WHO isn't measuring if countries are lowering smoking rates. They're measuring if they're attacking the tobacco industry. That's all they're talking about now.
So they've lowered, New Zealand has lowered the smoking rate in a manner in which that it's not approved of by the WHO.
Yeah, that's basically what they were saying yesterday.
So I've got the clip. We put together a short clip from New Zealand's statement yesterday. So the audience should be listening for this lack of success that so-called New Zealand has. Let's have a listen.
New Zealand has made great strides in implementing the Framework Convention on Tobacco Control and reducing smoking rates. Since 2012, the adult daily smoking rate in New Zealand has more than halved and is now 6.9%, among the lowest in the world. We are close to our goal of adult daily smoking prevalence of less than 5%. The theme of uniting for tobacco-free generation resonates strongly. We are committed to this goal, and we have seen great success. Among people 14 to 24, only 3% smoke daily. And of 15 to 17-year-olds, just 0.6% smoke daily. A new generation is growing up smoke-free. Since 2019, smoking rates have declined more rapidly in association with implementation of tobacco harm reduction measures, particularly regulated access to vaping products. We apply risk proportionate regulations to vaping products to ensure that they are available to support people in quitting smoking while discouraging youth uptake. New Zealand continues to tighten regulatory controls to protect youth, including retail, product and marketing rules to strengthen reinforcement. These measures are working. 2025 data shows that vaping rates continue to fall. New Zealand remains firm committed to reducing the immense harm caused by tobacco control, utilising all 3 aspects of tobacco control as defined in Article 1D of the Convention: supply, demand and harm reduction strategies. We look forward to sharing our experiences and learning from others as we work together towards a world where smoking no longer claims millions of lives.
I think that says it, doesn't it, that tobacco harm reduction they deployed in New Zealand, and that's probably what got them their Dirty Ashtray Award.
Yeah, this is amazing to listen to that statement and to think that, you know, right now the WHO is looking at this subjectively, not objectively. And therein lies the problem, is if you listen to that statement, this is something where they should have gotten a standing applause. There should have been people cheering and clapping and calling them and asking them, how did you do this? How can we emulate this? But no, they were chastised. The World Health Organization is saying, you are wrong. But no, they are absolutely right. And I got chills listening to that soundbite, because this is exactly what every country should be doing. Every 2 years, I want to see more countries reporting back to the WHO, talking about these successes. And I'm dumbfounded that the WHO is completely blind and deaf to what's happening in New Zealand.
Martin?
Yeah, I just watching, you just think, it's like the WHO watching that and saying, how dare you more than halve your smoking rate in about 4 or 5 years? How dare you have a dirty ashtray award? I mean, it beggars belief. It really does.
Let's what's driving the WHO to take this position where up is down, black is white, dogs and cats getting together?
Well, I would recommend everyone read an article published today. It's a site called The Firebreak, and this site has published an article about the funding, the millions and millions of dollars of funding. Yeah, that's the one there. It's astonishing to read. And now if you read that, you'll see exactly why they're doing what they're doing. They're not interested in anything apart from the money that Bloomberg has given them. And the WHO is now, just as he says in that article, completely bound by what Michael Bloomberg's millions are telling him to do. And there are people being paid a fortune for this. It's mentioned Campaign Tobacco Free Kids. They have 10 executives, Campaign for Tobacco Free Kids, 10 executives earning over $25,000 a month from this. When you read that and put it into context with what you've been talking about with New Zealand and Dirty Ashtray Award, it brings it home to you that this is an organisation interested in helping people quit smoking. It's only interested in the money that Bloomberg is giving it and to promote these anti-harm reduction messages.
It provides new fuel to the concept that we've talked about many times on RegWatch, and you guys together, is that there's a tobacco control industrial complex. And it's not just the regular public health people, it's all of these Bloomberg babies that are raking in, millions and millions of dollars.
Yeah, and what happens is, whether it's the WHO or governments in general, they get sort of addicted to the money, the Bloomberg money. Is because Bloomberg spends a lot of money in the United States and throughout the world for government officials, right? And they get addicted to that money. Talk about an addiction. It really is to Bloomberg money. And that's the frustrating part. And obviously, Brent, there's this, tobacco industry, they all hate the tobacco industry. So no matter what the tobacco industry does, and listen, the tobacco industry does not have a good track record. I mean, look at, the past number of years, Surgeon General's warning. The problem is that the tobacco industry is now changing because consumers are changing. Consumers want different products. The WHO can't wrap their head around this, is that this is the free market. This is the private sector figuring out what do consumers want now. And guess what? Consumers want less harmful choices. And the WHO just doesn't understand that the tobacco industry can be a part of this. And listen, it's not just about the tobacco industry. It's, mom and pop vape shops that are helping. It's really a whole sort of, ecosphere of people that are trying to produce these less harmful products.
Our next clip, and it's a shorter one. It's with Andrew Black, who is the acting head of the Secretariat of the convention, of the COP 11 convention. And everybody should just listen a little bit about how his tone is around the fact that 86 million people around the world, and that's their number, we know it's higher, are using e-cigarettes instead of smoking.
It is a great honour to welcome you to the 11th session of the Conference of the Parties to the Framework Convention on Tobacco Control. This year is particularly significant as we celebrate the 20th anniversary of the Convention's entry into force, a milestone that reflects 2 decades of global solidarity and unwavering commitment to public health. The WHO FCTC is more than a treaty. It's a promise to shield future generations from the harms of tobacco, to fight tobacco industry interference, and to put health before profit. And that promise matters now more than ever. New products, aggressive marketing, and misinformation threaten to undo the progress that we've all made. We cannot let this happen. Novel and emerging tobacco and nicotine products continue posing a growing challenge. Regulation of these products is lagging behind that of conventional tobacco products. Global tobacco use among adults aged 15 years and over has fallen from 26.2% in 2005 to 17.4% in 2024, a major achievement. But the high and rising levels of e-cigarette use is alarming. 86 million adults around the world currently use e-cigarettes, as do almost 15 million adolescents aged 13 to 15 years.
So the WHO, they can't seem to see anything that's good news as good news.
Yeah, I mentioned this yesterday in our sessions, that there's this guy, Andrew Black, who used to be at the Department of Health in the UK, by the way. I could tell you more about that, but we haven't got time. He's talking about 86 million. We know it's about 150 million people use safer nicotine products, but they're talking about 86,000 people. But 1.35 billion people smoke. He's not mentioning them. Not mentioning them at all. What he's doing, he's saying we need to stop these 86 million people from vaping. No, you need to stop the 1.35 billion people from smoking, is what you're supposed to be doing. That's supposed to be your job. You're acting head of the WHO FCT Secretariat. But they're not interested in that. They're just solely buzzing in on this stuff because Bloomberg is paying them to attack harm reduction products. It's astounding. It really is. That's the only way you can, it's just staggering.
Yeah, I mean, certainly it sounds like the WHO has been bought by Bloomberg. Is that too harsh to say?
No, it isn't too harsh to say. And I think, it is the 20th anniversary of the FCTC. And it's important to look at how this all started 20 years ago. And listen, I think it started with the best intentions, right? You had, 1.5 or 2 billion smokers back then, and cigarettes are bad for you. I mean, let's just call it for what it is. And I think the FCTC started out with a noble mission. We've talked to folks that were there 20 years ago that wanted this to be successful, that wanted to help public health, as it were. It's changed over the years. And the folks that we've talked to have actually gone into detail how the FCTC has changed over the last 20 years. And you really can't ignore the money. You can't ignore the Bloomberg money, the Bill Gates money. I mean, it really is a factor in what they're determining and what they want out of these conferences. And I have to tell you, I think that's why these conferences are becoming, I don't know if it's less popular, but I think there's more pushback. We see more pushback. We saw pushback in Panama. We're seeing it already this year with New Zealand, with Serbia, and Martin can talk a little bit about what Serbia said yesterday. But man, I hope that during the course of this week, we see more and more of these countries speak out and understand what the reality is. And the reality is science. The reality, are facts and what these products are and how they are less harmful. And listen, we're not saying, and nobody is advocating for people to take up these products if they're not using them. But if you are smoking a combustible cigarette, please consider these alternatives. And there's something for everyone, whether it's a pouch, heat not burn, e-cigarette, vaping, there's a little bit of something for everyone. And the World Health Organization is shutting down that consumer choice. They will be driving people back to combustible cigarettes, whether it's with excessive taxation or excessive regulation.
Yeah, I'd just like to say on that.
Yeah.
That point you were making there, Brent, about has the WHO been bought? Well, if I was a delegate at that conference and I read the firebreak this morning and I read all the money that's flying around, I would feel a bit conned, to be honest. Yesterday there were 31 representatives from Tobacco Free Kids at this event. That's a Bloomberg-funded organisation. 31 representatives. ENSP, which is another Bloomberg-funded organisation, 38 representatives of this thing. And this morning, yesterday morning, the first bulletin was produced by the Global Alliance for Tobacco Control, another Bloomberg-funded organisation. They mentioned us. They mentioned the TPA. They said US-based TPA planned parallel events and condemned the WHO FCTC for neglecting THR. So, which we're very happy about. We're great to be mentioned. But they're condemning us for doing this and hinting that we're all acting in the furtherance of the tobacco industry. But this was written by Bath University, which is another Bloomberg-funded organisation. And the other article in that bulletin was written by the Global Centre for Good Governance in Tobacco Control, another Bloomberg-funded operation. I mean, it's astonishing. And they're saying that we've got some vested interest when they have conflicts of interest in every corner of that conference. If I was one of those delegates, I'd be completely conned, and I feel like I've been being gaslighted by these people.
Oh, for sure. And I'm glad you mentioned the Global Alliance for Tobacco Control, because they're on our list to talk about today. Here's a document they put out just prior to, yeah, nice, yeah, good laugh there. Facts Matter, Countering Industry Misinformation Around COP. And I do encourage people to find this, which is easy to find. It's amazing because they sound so defensive with this particular document. Myth number one, the WHO FTC has gone off course and is no longer fit for purpose. Check. That's about right. Myth number two, not a myth. The WHO is becoming an obsolete institution that countries are abandoning. Well, that's happening. Myth number three, WHO runs COP and undermines governments. So the WHO runs the COP. Well, that kind of sounds to be true. Myth number four, the WHO FCTC undermines economic development and pushes low and middle income countries. And we've heard that often. Dr. Pang was one that has brought that up on our show. And myth number five, the WHO and COP meetings are secret and closed to the public, lacking transparency. And they say that is a myth. Tell me, what do you think?
So Brent, let me kind of save some of your sanity here, okay? I want you to read this in reverse. And that's what I did. When I was looking at the myth versus reality, I just reversed both of them, and then it made sense to me. Because it doesn't make sense the way that it's currently written, because it's completely opposite. And I guess they wrote this on opposite day or whatever, but it's laughable that they put this out. So for your sanity, please read it the opposite way.
Martin?
Yeah, I saw that, and I sent to our little group, yeah, TPA's good group, and we all had a good laugh about it. I mean, how can myth number five about consumers not being allowed in the conference be a myth? It's just, I mean, what land are these people living in? I mean, they're in cloud cuckoo land or something, aren't they?
Yeah, they're smoking their supply, that's for sure. So, Martin, I've got a clip here that I know that you're probably going to want to comment on, being from Europe. And this is the EU and their presentation yesterday in the opening session. So let's have a listen. And it's not playing. 1 second.
Address you all on behalf of the European Union and its 27 member states. This is a special occasion. 20 years ago, the adoption of the Framework Convention on Tobacco Control marked a shift in our fight against tobacco worldwide. The Convention is the first global public health treaty of its kind. It has transformed tobacco controls at all levels, brought all of us together in support of a common goal, and saved millions of lives. Smoking rates remain high, and new tobacco and nicotine products are being aggressively marketed to children and young people. We are revising our tobacco control legislation to better protect children and young from these new products. We have already imposed an EU-wide ban on heated tobacco products with characterizing flavors. And EU member states took another step when they adopted the Council recommendation on smoke and aerosol-free environments in 2024. This recommendation addresses a wide range of tobacco and nicotine products and recommends to extend the scope of smoke-free areas to more outdoor spaces, especially where children, young people and vulnerable people may often be present, such as playgrounds and beaches, and as well as education and healthcare settings. This year, the European Commission has proposed the revision of our Tobacco Taxation Directive to extend its rules to smokeless tobacco products, liquids for e-cigarettes and other nicotine products. The fight against tobacco is far from over. The market is evolving constantly with new products and new digital marketing methods that target children and young people especially. We need to be ready to react to the new developments and consumption trends which threaten to undermine our progress. This requires serious collective effort free from the influence of the tobacco industry. Tobacco and nicotine products destroy not only our health, but also harm the health of our planet. Contamination of soil and water by waste from these products is a global problem. We must also focus on environmental sustainability in the field of tobacco control.
So, Martin, I know it's one of your favorite discussions about how they want to make it that you can't vape on a beach.
Yeah, there was a big argument, wasn't there, in the European Union when it came to working out their common position for COP. So, I mean, what was said there is just flim-flam, really, isn't it? Because they can't really say a lot because they're split down the middle. You had the prohibitionists like France and Belgium wanted to go full on and ban everything, and you had countries like Italy, Greece, Sweden said no, we're not having any of that. And I think their common position, they actually had to prohibit the word bans in there because that was a sticking point. So what she said there is just flim-flam to support the WHO and to just fit in with everyone else because they really can't do a lot.
I saw, I saw a report that WHO Director General Dr. Tedros may have made a statement yesterday, and tell me if this is true or not, that vapes and pouches are not harm reduction products, but harm production products.
He did, yeah. He did that. There was a ministerial roundtable and a strategic dialogue, which were basically the same thing. And he did two speeches, and he said almost exactly the same thing at both speeches. Talked about children, flavors, sweet flavors, and bright colors, and then said how these things are really harmful. And yeah, he said it's not harm reduction, it's harm production. He said. But I did agree with one of the things he said at the speech at the end. He said every tobacco death is a preventable death. Well, it's true. Every tobacco death is a preventable death. And the only people trying to prevent those deaths, get in between preventing those deaths, and is the WHO at the moment, because they're standing in between products that can help people stop smoking and trying to ban them. So I don't know. I don't think we can do anything with Dr. Tedros. We mentioned him yesterday in a couple of the panels, and it was generally thought that he has to go. We had one panel yesterday with Roger Bate and Clive Bates where Clive said they're meant to disagree with each other on this, but they tend to agree on this. Clive said that Dr. Tedros shouldn't have been appointed in the first place, and Roger Bates said he should have been fired after the pandemic. So everyone seems to be in agreement that he's pretty ineffectual. So you just got to hope that the WHO moves on and appoints someone who knows what they're doing in future.
And Brent, let's just remember what happened a few years ago at the start of the COVID pandemic, is that the World Health Organization put out this infamous tweet saying that COVID was not transmittable airborne, that it was not an airborne disease. Well, that was wrong. That was 100% wrong. So I don't know if I'm going to listen to the WHO science very often, especially after that was a huge mistake. And listen, that's a whole nother show about, what that motivation was, but they are not pro-science, they're anti-science.
Yeah, they do seem to be anti-science. How could that possibly be?
I don't think they're a science organization anymore. They're a political, yes, they're science, political science, not the real empirical science that people need. So I think that's what's happened. And again, goes back to what we were talking about earlier, is the money, the corrupting influence of Bloomberg, of Gates, is that they're more political science than they are empirical science.
Let me bring one last thing up for you guys before we start to move towards the interviews that we've got for today. And that is, we did an interview today with Nick Grimm-Green, who's a 16-year YouTuber, who's a diehard vape advocacy person, and he's got a massive following. And man, he's getting dinged by YouTube enforcement right now, which appears to be only, because of a new nicotine policy around medical misinformation that YouTube has. And pretty much it's saying that unless you are being very clear about nicotine's harms, you might get your content pulled down.
Incredible. And this, to me, goes to free speech. I think this is absolutely a free speech issue. And I think there's a lot of misinformation about nicotine. There have been studies where they've asked doctors about nicotine and cancer, and oh my gosh, I think it was 60% of doctors that were queried say that nicotine is what causes cancer in smoking. oh my goodness, that is so far off the mark. It's not even funny. So I think it's free speech, it's anti-science. There's a lot going on, but especially when it gets these free speech issues, that's when it really, I think, is going to more people are going to really take alarm at that. 'Cause I think a lot of people may not be paying attention to the vaping, the smoking issue, but when you start limiting people's speech, I think you're going to get a bigger audience in opposition.
I agree. Martin?
Yeah, I agree with much of that, really. And you think you're allowed to say a lot of things on the internet, but why has this all of a sudden become an issue? Yeah, we've got conspiracy theorists, you've got people, truthers, 9/11 truthers and stuff like that. They seem to allow to publish their videos, okay, but you say that nicotine might not be harmful on its own outside of smoked tobacco, and apparently now that's misinformation, even though it's true. Again, it's very worrying, and you think who's behind all that sort of stuff as well.
Well, the only way the inversion of reality that WHO and groups like the Global Alliance for Tobacco Control can maintain this upside down world is if they have alliances with major media companies and platforms like YouTube that can help enforce the narrative that allows it to stick and doctors to become more misinformed than a vapor at a vape shop.
Yeah, well, I did a webinar with Derek Yak recently, and he was talking about some of the YouTubers who talk about the benefits of nicotine. And he said one of them's got 100 million, I think he's got 100 million subscribers or something like that. So I think hopefully they're going to have a much more tougher time trying to come up against those guys who are actual medical doctors saying that nicotine has some benefits. So we'll have to watch that. But if they're starting to ban people, like David said, that's a freedom of speech issue, isn't it?
Yeah, it is. All right, gentlemen. So we're going to jump to a clip and then come back with 2 interviews with 2 great people. That'll be good. And then when we bring you guys back, we'll talk a bit about what's happening the rest of today or the start of your day there for a Good Cop Day 2.
Fantastic.
Sure.
Dr. Bate, would you call the WHO's position on safer nicotine products to be resistance? And if it is resistance, is it dangerous?
I think the WHO's position on market-driven tobacco harm reduction products, so vaping pouches, is definitely resistance, occasionally hostile. In print, they say things which are outright lies. And yes, that's absolutely dangerous, because if you ridicule countries by giving them dirty ashtray awards because they're promoting vaping and other tobacco harm reduction, the lesson you're learning is that you're going to be criticized publicly if you do this, and it requires a strength of mind of the health ministers of these countries to stand up and say, I'm looking at the evidence clearly, and I think we should promote these. So it's at the margins. As an economist, I would say that at the margins, it's definitely harmful. How harmful? It's very hard to measure. But it's when you are pushing forward a position which is antithetical to the evidence base, then it's going to be damaging.
Dr. Bate, let me show you a few of the WHO's classic tweets when it was Twitter and still on X. Over and over and over again, the WHO, and these are beginning in 2020, make it clear or at least stoke confusion when it comes to e-cigarettes. E-cigarettes and other vaping products are dangerous. That's pretty clear cut. Do e-cigarettes cause lung injuries? And the answer, of course, they provide is yes. Are e-cigarettes more dangerous than regular cigarettes? How could that be a good message?
Well, it isn't. I mean, that's the simple truth, that these are not good messages. There is a difference between is there zero risk from a product? Is there a hazard in using a product? And is the relative risk profile better? This is something that rational, sensible people should be able to understand. And the WHO has certainly got plenty of able scientists and other thinkers who can understand this. It's like, I don't smoke, but I do drink. I know that if I drink 3 or 4 beers, it's not particularly healthy for me. And I know that if I drink, half a bottle of whiskey every day for 15 years, it's going to be hugely detrimental. and the dose makes the poison, as Paracelsus said 400 years ago. So it's like almost anything can become harmful if you do too much of it. But the relative risk aspect of this is that a pouch and vaping doesn't have to be perfectly safe to be massively better for you than smoking. And it's as though there is, and I think this feeds into other things. There is an absolutist position that they're taking, which is that only abstinence is the correct way forward. And I think that's a position that an individual physician might want to take if they're particularly zealous in going after smoking. But it is not a rational position, and it is not a correct public policy position. And that's the key part of this. It's like you should be designing public policy based on the best outcomes for the vast majority. And that would include trying to help people to stop smoking and using other forms of nicotine. It's not to say that we're encouraging kids to take up nicotine products. It's to say that if you're already smoking, you should switch to these things. But at the same time, I would add that as someone who drinks, I'm not only not addicted, I don't take nicotine as far as I can tell in almost any product. But if you actually use nicotine and you help it, I remember, all the newsrooms around the world, my sister used to be a journalist a long time ago, and they were always foggy with cigarette smoke. And from my reading of the psychopharmacology literature, and I am no expert in this at all, smoking and nicotine helps concentration. And so if you use nicotine to help you concentrate, good luck to you. I use alcohol to help me relax. It's like we all use things which are very good. How many people get headaches if they don't drink their cup of coffee in the morning? I'd say probably 50% of people. So we're all addicted at some level to caffeine. So the idea that you should do nothing that's potentially risky is crazy. We should be autonomous beings that can make our own decisions, informed decisions. So the WHO, as an information body, primarily it should be alerting people to the potential risks of vaping products, but at the same time saying they're a lot safer than cigarettes.
And joining us today from Good Cop 2.0 is Maria Papaiwanu-Duick. Maria is the founder.
Thank you.
Maria is the founder and spokesperson for Rights for Vapers, which is Canada's largest movement advocating for access to safer nicotine products. Maria, it's great to see you.
It's nice to see you too. We're much further away this time.
Yes. Well, last time I saw you was just in June in Poland, in Warsaw.
Yeah, we were though in the same time zone. Now we're many, many, many time zones away.
So tell me, are you an autonomous human making your own decisions?
Absolutely, I am. I am also an autonomous human who's making my own decisions on what I can or cannot say and the positions that I choose to take.
So tell me, what did you think of the first day of COP11?
Well, I'm just finding it so perplexing that they're choosing to lie. It is a conscious choice at this point of the position that they want to take. They know that the things that they're saying are untruths. They're choosing to lie. And, we can sugarcoat it by saying disinformation, misinformation. It's lies. There's no information being shared that is accurate. So that's the definition of lying. And it kind of breaks my heart because last night I pulled up, and again, I am so Canadian and I'm so proud of our Canadian people. And when I'm looking on the delegation list and I'm doing the search, University of Waterloo, yes, Jeffrey Fong's there. And I feel like these people, and obviously Rob Cunningham's there, he's the same person wherever he is. But there's some people who become different people based on who they are around. And I feel that Jeffrey Fong, even though he's not really the greatest supporter of vaping, he doesn't say such outrageous lies. And when they come here, they feel that pressure it's like high school for them. They feel that pressure to say the same things that their friends are saying. So now I'm trying to understand, maybe because they're influenced by the money, that they start accusing everyone else that disagrees with them, that they're influenced from the money. So maybe it's from a position of, it happened to me. So that's kind of the way I'm seeing it. And I'm very disappointed that Les Hagan is the advisor to Health Canada. I wish that the team at Health Canada chose a consumer. They have a wonderful consumer group that is not being tainted by anybody. Vapors for Smoke-Free Canada, they could have chosen one of those incredible people that sit on that movement in Canada. But again, Les Hagan showed up there.
Well, and it's not just Les Hagan. As you said, Rob Cunningham is there, and he is one of the biggest, critics of safer nicotine products in Canada. But it's not just that. The Global Alliance for Tobacco Control is based in Canada. It's like, really, Canada.
I'm so embarrassed.
We're by far the biggest country of tobacco controllers that are against safer nicotine products than probably anywhere else.
I know. And it's like, I figured this out at COP10 that GATC, was it GATC? Yeah, GATC is located in Ottawa. And I was like, oh my goodness, this is Canadian. And then when you dig deep, they're associated with, I think it's called Bridgepoint Health. I just kind of started reading about this morning. So, and also all the NGOs, all the tobacco control NGOs were associated with Bridge Health because us Canadians helped Vietnam become vape free. Congratulations to us for helping kill an entire country of people who smoked. So, here's the thing. These people, tobacco control, Rob Cunningham, cannot put their ideologies into Health Canada. They haven't been able to infiltrate Health Canada, for lack of a better word. So what, now they're focusing on third world and second world countries? And then we have GATC that is funded by Bloomberg. Like, come on. And also, if you've noticed in there, I kind of did a little bit of research this morning on them. No one's from Canada on their board. Rob's no longer on that board, maybe because he got in trouble. Because you have to remember, these people also have jobs. Rob Cunningham works for the Cancer Society. He can't be just handing out derogatory and stigmatizing awards. Like the ashtray award bothers me so much because they're perpetuating a stigmatization. And how many times as someone who smoked, or I remember when I smoked, my mom would say, oh, what boy would want to kiss a dirty ashtray? And I'm like, have you licked a dirty ashtray before? Do you know what it tastes like? But again, it's that stigmatizing language that is perpetuated against people who stand up for what is right.
The one thing about the Global Alliance for Tobacco Control, as I understand it, this organization is its access is so much that they actually shadow delegates. So from the countries that are there, and they're kind of tasked with kind of minding them. Is that true?
Oh my God, that sounds like Scientology. Like, for lack of a better word, that sounds like Scientology. Everybody has their keeper. What is his name? Tom Cruise. He has a keeper. He has someone like you. When you read that, like, that's cult-like behavior. Come on. We've got to do better. Allow people to think, allow people to have ideas and concepts that work. And I think one of the things that really bothers GATC is that our government in Canada respects our charter. And in our charter, and thanks to people like Mark Tyndall, we have access to harm reduction. And Mark Tyndall was part of a team that challenged that access and challenged the charter to ensure that we have access to harm reduction. And that's why flavors are so important. And this is why we don't have a flavor ban. So it doesn't matter what the World Health Organization says. And, I want Canada to receive a Dirty Ashtray Award, because if Canada and the delegation receives that Dirty Ashtray Award, it means it's standing up for what is right. And to me, I'm going to rebrand that and congratulate the countries that get Dirty Ashtray Awards. It should be something that you want because you are a change maker, and nothing is going to change if you do not shake what's happening. You sit there and you freak people out by telling the truth. They should have asked me to be part of the delegation.
They should have asked you to chair the entire convention.
Oh God, no, I don't need that right now. But I could have went along with Health Canada and made friends with all those people.
Well, you're a force, Maria, that's for sure. Enjoy your time in Geneva and, raise some hell.
I will. I will. Thank you, Brent, and everybody in Canada. Make sure you follow along with Taxpayers. Taxpayers Protection Alliance. It's very early here. So thank you.
All right. Have a good one. Thanks, Maria. So, Martin, as we talked about with the experts, the FCTC has its own expert groups. How do they measure up?
Well, they're expert groups. It's debatable whether they're experts, isn't it, really? I mean, you have expert groups and you have working groups. Working groups, any party to prevention can say, I'd like to join a working group to discuss this. Expert groups are hand-picked people by the WHO. Most of them cherry-picked prohibition advocates from non-governmental organisations and stuff like that. And a lot of them are just basically appointees. So I wouldn't call them expert groups at all. We have real experts. We have policy experts. We have people who've written hundreds of research papers. We've got people who've advised governments. We've got consumers who are the biggest experts of the lot because they're the ones who use the products, and they can. It is frustrating as a user myself, nicotine user myself, to see politicians talking absolute nonsense about vaping, and not coming to people like me, the consumer, and actually asking for the real facts about it. Just a very quick example. The very first person who spoke at the Tobacco and Vapes Bill speeches on the second reading in Parliament came out and said that vapes are completely unregulated and they cause popcorn lung. This is an MP, and he came out with that. Of course, they're regulated massively with the TRPR regulations in the UK by the Tobacco Products Directive in the EU, and they don't cause popcorn lung. So, but did they bother to ask any consumer group along to give evidence? No, they didn't. And they also excluded industry. So it is, I don't know, we have the experts. We've got the experts. We've got the people who know about these products. WHO doesn't want to have any experts. They don't want to, I mean, what they actually say about these things is wrong. They cherry pick evidence to fit in with their prior ideology. And we have regulators all over the world who just aren't interested in knowing the science. They just don't care.
So here we are with Marina Murphy, who's also joining us today live from COP 2.0 in Geneva. Dr. Murphy is the Director of Scientific Affairs at, now this is going to be hard for me to say, is it HAEP Group in Scandinavia? And former head. Group. It's what is it called?
It's HAEP Group. My boss maintains it's happy for dyslexics.
Oh, that's
if you're
funny.
Allowed to say that.
So Marina has been on our show before talking about science. You are got your PhD in chemistry. Is that not correct?
Correct. Yeah.
So
I actually
fill us in on how that connects with tobacco harm reduction.
Well, I didn't study tobacco harm reduction or nicotine in the first place. I studied chemistry. And the chemistry I studied was actually looking at the potential link between Alzheimer's and aluminium, and where that aluminium could potentially come from. And one of the sources was aluminium pots, which used to be used quite regularly, when I was a student anyway. And of course, the big link between that and tobacco harm reduction and smoking and the use of nicotine is, of course, chemistry, because it's all about chemistry. And we need to know everything about the chemistry of smoke, the chemistry of nicotine, the chemistry of the aerosol, what it does to the person. And only by knowing that, we know how to reduce the potential health impacts.
So when it comes to the science around tobacco harm reduction, in your opinion, how does the WHO shape up?
Well, there's very little done or said that I would consider to be scientific in the context of the FCTC. The top line objectives are all about, end games and nicotine-free worlds. So, they're always talking in absolutes, and we know in science there's no absolutes. We talk about relative risk trade-offs and population effects. So this idea of eradicating a substance for the sake of eradicating it, or you don't like it without any sort of consideration of the risk profile or the relative risk profile, is not a scientific evaluation. It's not a policy for improving health. It's a political, it's an ideological aim. And I think what's worse is when you start talking about the use of nicotine as something that's inherently harmful or wrong, which is, I think the implication, wrong or socially unacceptable, you're absolutely moving the conversation entirely away from science altogether. We're not talking about the nuances of science. Now we're talking about moral judgments. So now we're making moral judgments. We're not talking about reducing death and disease. So we're making moral judgments of smokers, the very people that we're supposed to be helping. And also then that justifies very prohibitive or restrictive policies that have nothing to do with reducing death and disease, in my view.
So the WHO is making a lot about nicotine addiction, but when you comb through all of their documents and communications on the issue, everything, for this convention, the FCTC, they never detail what the actual harms are of nicotine use.
Well, when you think about addiction, the very definition of addiction is, basically the compulsion to repeat a behavior that is harming you. So I would say, and this isn't just me now, there is a definite debate in the scientific community around what's addictive and what's dependence forming. So I would say it's probably more correct to say that smoking is addictive, whereas the use of nicotine is arguably dependence forming. And there was a very good editorial written recently by the editor-in-chief of the arguably #1 journal in this sector, which is Nicotine and Tobacco Research, NTR, and she makes that point actually very well. She puts that point to the tobacco control community and asks the question, is nicotine addictive or is nicotine dependence forming? And I would argue that it's probably dependence forming.
Yeah,
not least because it's an essential medicine as well. Don't forget, it's listed by the WHO, another contradiction, as an essential medicine, and is used in nicotine replacement therapies for 50 years.
As I just mentioned earlier in the show today, that it's appearing that Google, YouTube, has brought in a medical misinformation policy that's basically saying that unless you fully commit to the harms of nicotine and communicate that as the priority, you could get your content pulled down.
Well, I don't know how they're going to police that, because there's so many things. Like, what's really interesting is if you look on a website, it's called mindstudy.org. And it's funded by the National Institutes of Health in the US. And so MIND stands for Memory Improvement Through Nicotine Dosing. So they are currently in the process of doing a big study of giving people nicotine. And, and they reassure the people that, there is no worry about taking the nicotine, and that potentially if they have memory problems, that it's going to help them. So I wonder if Google will take that down.
That's great. Here, I've got this right here. I'm gonna have a quick look at it. That's amazing.
Yeah, and if you scroll down and you look at the organizations that are involved.
So the NIH, Keck, Vanderbilt.
Well,
yeah. So there you go. I mean, that's a perfect example, because I'm sure that they're not going to be policed on YouTube in the same way that, say, Grim Green is.
And when you think about that and those kind of studies, and then you think about a lot of the narrative around nicotine, it's no wonder that people are confused by it. Because I think in a previous interview, somebody was talking about the confusion of, health practitioners. They are very confused. And it is true to say that a lot of them will report that they do think that nicotine causes cancer. And then the other thing that's quite interesting, and I think it all goes back to the positioning of groups like the WHO, when you look at medical curriculum and how nicotine and smoking is dealt with. So when people study medicine, it seems that they're very well educated about the harms of smoking, but don't really understand the benefits of quitting, and also don't understand the benefits of switching to alternative nicotine products. And it's amazing when you look at the stats and hear and understand how very little it is discussed in the medical curriculum around the world.
So final question for you, Marina. What do you hope to get out of your time at Good Cop 2.0?
Well, given that Bad Cop doesn't really allow anybody to go, in particular scientists who don't agree with their positioning on nicotine and tobacco harm reduction, I think Good Cop provides a platform to talk about, evidence-based science, and also to talk about approaches that could help people rather than just restricting their choices.
Well, that's great. Oh, thank you so much for joining us today.
Thanks, Brent.
Gentlemen, how are you?
Fantastic. Looking forward to the panels today, that's for sure.
So do tell us about what people can expect at Good Cop 2.0 Day 2.
So, I've been thinking about this in musical terms, right? And I think of the Carpenters. We've only just begun. This is day 2 of the conference, and we're going to have a panel called The Battle Over Science, which I think is a little bit strange because there shouldn't be a battle over science. Science is what it is. And Dr. Murphy was talking about that, that science is absolute, not absolute, but there's the facts there. So that's one of the panels. Now, I'm really excited that we're going to have a panel completely in Spanish. This is the first time that we're doing this in another language, but I think, at the next COP, Good Cop will do the same thing, maybe have another panel in another language. But again, we need to reach out to as many people as possible so they know what we're doing here in Geneva.
And Martin?
Yeah, we've got...
Gentlemen, it sounds like we've got a problem with your audio and video, so we made it to the end. So good luck and enjoy Day 2 of Good Cop 2.0. Well, that's it for this special edition of RegWatch Live. Before you head off, please hit subscribe down below on YouTube, like us on Facebook, and don't forget to follow us on X. For RegulatorWatch.com, I'm Brent Stafford.